You've likely been told your entire life that showering every single day is a must. It's a habit so ingrained in our culture that anything less might feel, well, unclean. But what if that's not actually true, especially for seniors? What if the very act of daily showering is doing more harm than good? It's easy to assume that frequent washing is always better. After all, don't we associate cleanliness with good hygiene, better health, and overall well being? But here's the shocking truth. For older adults, daily showers may not be necessary, and in many cases, they can even be harmful. Let's take a moment to challenge what we think we know. Have you ever noticed how your skin feels after a long, hot shower? Maybe tight, dry, or even a little irritated? Now imagine that sensation amplified by aging skin that naturally becomes thinner, drier, and more sensitive over time. For seniors, this seemingly simple habit, one they've likely followed for decades, could be stripping their skin of essential oils, leading to dryness, irritation, and even an increased risk of infection. And that's not the only concern. The shower itself, with its wet, slippery surfaces, is one of the most dangerous places in a senior's home. Falls in the bathroom are a leading cause of injury for older adults, and excessive showering only increases the chances of these accidents occurring. So, if daily showers aren't the answer, then what is? How often should seniors really be bathing? The answer might surprise you. Today, we're peeling back the curtain on this common misconception and revealing what the experts say about senior hygiene. By the end of this, you'll have a clear understanding of why less might actually be more when it comes to bathing in your golden years. So stay with me, because this might just change your approach to personal care forever. Section 1, the cultural myth of daily showers. From the time we were children, most of us were taught the same thing: shower every day, or else you're dirty. It's as much a part of our daily routine as brushing our teeth or eating breakfast. But where did this belief actually come from? It turns out the idea that daily showers are essential isn't as old as you might think. In fact, just a century ago, bathing was far less frequent. People often relied on quick sponge baths, and a full body soak was considered more of an occasional luxury than a necessity. So what changed? The shift toward daily showers can be traced back to a combination of factors: modern plumbing, advertising, and evolving social norms. In the early 1900s, when indoor plumbing became more common, daily bathing became a symbol of progress and good hygiene. But it wasn't until the rise of the soap and deodorant industries that showering every single day became an expectation. Companies pushed the idea that frequent washing was necessary, not just for cleanliness, but for social acceptance. Advertising campaigns suggested that anything less than a daily scrub made a person undesirable. Over time, these messages became so deeply ingrained in our culture that we stopped questioning them. But here's the thing: just because something is common practice doesn't mean it's the best choice for everyone. Take a moment to think about it. We don't all eat the same foods, wear the same clothes, or follow the same routines. Our bodies are unique and our needs change over time. And yet, when it comes to hygiene, we still cling to the idea that one rule should apply to all. But should a 25-year-old construction worker who sweats all day really follow the same showering routine as an 80-year-old retiree who spends most of their time indoors? It doesn't quite add up, does it? The truth is, as we age, our bodies change in ways that make daily showers not only unnecessary, but potentially harmful. Senior skin becomes thinner, producing fewer natural oils. This means that excessive washing, especially with harsh soaps, can strip away the skin's natural moisture, leading to dryness, itching, and even cracks that make it easier for infections to take hold. But because the daily shower habit has been drilled into us for so long, many seniors continue following it, even when it's causing them discomfort. And here's another factor most people don't consider. Hygiene isn't just about showering. In fact, showering daily doesn't necessarily mean someone is cleaner or healthier. After all, it's not our entire body that gets dirty every day. It's certain areas, like our hands, face, and underarms. So why do we assume that washing head to toe every single day is the only way to stay clean? This rigid mindset is part of the problem, and it prevents many seniors from adjusting their routines in a way that actually benefits their health. So if daily showers aren't the golden standard for hygiene, then what is? In the next section, we're going to dive into what science and experts actually recommend for senior bathing routines. You might be surprised to learn that showering less often, just a couple times a week, could be the best thing you do for your skin and overall well-being. Section 2, the science behind senior skin and hygiene. Our skin is our body's largest organ, and just like the rest of our body, it changes as we age. One of the most noticeable differences is that it becomes thinner and more fragile over time. This happens because the skin loses collagen, natural oils, and moisture, making it more prone to dryness, irritation, and even small cracks that can lead to infection. When we're young, our skin can handle frequent washing because it quickly replenishes its natural protective barrier. But for seniors, daily showering can strip away these essential oils, leaving the skin vulnerable to damage. Scientific research has confirmed these effects. A study from the University of Pittsburgh found that older adults who showered daily were more likely to experience skin dryness and irritation compared to those who showered less frequently. The researchers noted that frequent washing, especially with hot water and harsh soaps, disrupts the skin's natural balance, leading to increased sensitivity, itchiness, and even inflammation. Similarly, a report from the University of California, San Francisco, UCSF, highlighted that overwashing leads to a condition called xerosis, or abnormally dry skin, which is common in seniors. This condition can cause flaking, redness, and even small tears in the skin, which open the door for bacteria and infections. But the concerns go beyond just skin health. A study published in the New England Journal of Medicine found that seniors who showered less frequently had a lower risk of developing painful skin tears, which can take longer to heal in older adults. These findings suggest that reducing shower frequency isn't about neglecting hygiene. It's about preserving the body's natural protective mechanisms. Beyond skin issues, excessive showering poses safety risks for seniors. The American Geriatric Society warns that the bathroom is one of the most dangerous places for older adults due to wet, slippery surfaces. A simple misstep while stepping into or out of the shower can result in a serious fall, leading to broken bones, hip fractures, or long recovery periods. Additionally, the Journal of the American Medical Association, JAMA, has pointed out that showering can be physically exhausting for some seniors, especially those with mobility issues or heart conditions. The combination of hot water, prolonged standing, and bending over can lead to dizziness, shortness of breath, and an increased risk of falls. These studies don't suggest that seniors should stop bathing altogether. Far from it. Rather, they indicate that showering every single day is not necessary for good hygiene and may actually do more harm than good. Instead, a more balanced approach is needed, one that considers the individual's skin health, activity level, and personal comfort. In the next section, we'll break down exactly how often seniors should shower and what factors determine the best hygiene routine for older adults. Section 3, how often should seniors shower? After decades of being told that daily showers are a must, it might come as a shock to learn that experts actually recommend that seniors shower only once or twice a week. Yes, you read that correctly, just 1 or 2 times per week. Before you dismiss the idea, let's take a closer look at the reasoning behind this advice. For seniors, showering less frequently helps preserve the skin's natural moisture, reducing the risk of dryness, irritation, and infections. The skin doesn't accumulate as much sweat and dirt as younger individuals who engage in high-energy activities, so it doesn't need to be scrubbed down as often. Experts from the Cleveland Clinic suggest that for most older adults, washing key areas daily, such as the hands, face, underarms, and groin, is sufficient to maintain hygiene without the risks associated with full-body showers. However, the exact frequency of showering depends on individual needs. Here are a few factors that determine how often an older adult should bathe. Physical activity. Seniors who are still very active, whether through exercise, outdoor work, or gardening, may need to shower more frequently to remove sweat and dirt. On the other hand, those with a more sedentary lifestyle can go longer without full-body washing. Skin sensitivity and conditions. Seniors with conditions like eczema, psoriasis, or extremely dry skin should limit full showers and instead focus on moisturizing and using gentle, fragrance-free soaps when washing. Mobility and safety concerns. If getting in and out of the shower is difficult or poses a fall risk, reducing the number of showers per week can help lower the chances of bathroom injuries. Instead, caregivers or seniors themselves can use alternative hygiene methods such as sponge baths or cleansing wipes. Medical conditions. Some seniors may have medical conditions that require more frequent washing. For example, individuals dealing with incontinence may need to clean their lower body more often to prevent skin irritation or infections. Similarly, those with open wounds or specific skin concerns should follow their doctor's recommendations for bathing. The key takeaway here is personalization. Hygiene isn't a one-size-fits-all approach. Some seniors may feel more comfortable with an every other day shower, while others may find that a twice-weekly schedule with daily spot cleaning works best. The goal is to balance hygiene with skin and safety concerns, ensuring cleanliness without unnecessary harm. That brings us to the next question. If full showers aren't needed daily, what are the best alternatives to stay fresh and clean? In the next section, we'll explore practical hygiene strategies that help seniors maintain cleanliness without overshowering. Section 4, Alternative Hygiene Methods. If showering every single day isn't necessary or even ideal for seniors, then how can older adults maintain hygiene without compromising their skin or safety? The answer lies in alternative hygiene methods, simple, effective strategies that keep the body clean without requiring a full shower. These methods not only help protect aging skin, but also reduce the risks associated with frequent bathing, such as slips, falls, and excessive dryness. Let's explore some of the best ways seniors can stay fresh and hygienic while minimizing the negative effects of overwashing. One of the most effective alternatives is the use of sponge baths or wet wipes to freshen up between showers. Many seniors may feel uncomfortable skipping their daily shower, but a quick sponge bath can provide the same feeling of cleanliness without the risks. Using a warm, damp washcloth with mild soap, seniors can clean key areas such as the face, underarms, groin, and feet without stepping into the shower. No-rinse cleansing wipes are also a great option, especially for those with limited mobility or those who find it difficult to stand for long periods. These wipes are gentle on the skin, easy to use, and help remove bacteria and sweat without stripping away natural oils. Another important hygiene practice is frequent hand washing. While full body washing may not need to happen daily, keeping the hands clean is non-negotiable. Seniors should wash their hands regularly, especially before eating, after using the restroom, and after touching shared surfaces. This is not only essential for personal hygiene, but also helps prevent the spread of germs, something especially critical for older adults with weaker immune systems. Using mild, moisturizing soap can prevent hands from becoming too dry or cracked. Facial hygiene is another key aspect of staying fresh. The face collects dirt, oil, and sweat throughout the day, so washing it regularly helps keep the skin clean and prevent breakouts or irritation. A gentle, fragrance-free cleanser is ideal for seniors, as harsh soaps can strip moisture from the skin. In addition to washing, applying a light moisturizer can help maintain hydration and prevent the tight, dry feeling that often comes with aging skin. For hair care, daily shampooing isn't necessary for most seniors. In fact, overwashing can lead to dry scalp, irritation, and brittle hair. Instead, seniors can wash their hair once or twice a week, depending on their personal needs. For those who want to keep their hair feeling fresh between washes, dry shampoo can be a great option. A light spritz at the roots can absorb excess oil and add volume, making hair look and feel cleaner without the need for water. Additionally, a scalp massage with a damp towel can help remove dirt and sweat without requiring a full wash. Clothing hygiene is just as important as body hygiene. Even if a senior isn't showering every day, wearing clean clothes and changing undergarments daily can make a huge difference in feeling fresh and maintaining good hygiene. Sweat and bacteria can build up on clothing, especially in areas like the underarms and groin. Seniors should focus on wearing breathable, moisture-wicking fabrics that help keep the skin dry and reduce irritation. Regularly changing socks and wearing supportive, clean footwear is also crucial for preventing foot infections, which are more common in older adults. For seniors with mobility challenges, caregivers or family members can assist with bedside hygiene care, ensuring that personal hygiene is maintained even if full showers are difficult. Products such as rinse-free body washes, gentle cleansing foams, and skin-friendly wipes make hygiene easier without requiring a trip to the bathroom. Many of these products are designed specifically for seniors and individuals with limited mobility, making personal care more accessible and comfortable. Oral hygiene is another often overlooked part of daily cleanliness. Even if a senior isn't showering daily, they should still brush their teeth at least twice a day and clean dentures properly to prevent bacteria buildup and gum disease. Using a soft bristle toothbrush and fluoride toothpaste can help protect aging gums and teeth, ensuring good overall health. For those with difficulty brushing, antibacterial mouthwashes or oral swabs can help keep the mouth clean and fresh. Finally, using mild deodorants and freshening sprays can help seniors feel cleaner without needing a full shower. Aluminum-free deodorants or natural antibacterial sprays can help prevent body odor while being gentle on sensitive skin. Some seniors may also find essential oil-based sprays or lightly scented body powders useful for absorbing moisture and keeping the skin comfortable. The key takeaway from these alternatives is that full showers aren't the only way to stay clean. By focusing on targeted hygiene strategies, seniors can maintain freshness while protecting their skin, reducing fall risks, and preserving their energy. In the next section, we'll explore how seniors can make showering safer and more comfortable, ensuring that when they do bathe, they do so in the safest way possible. Section 5, Safety Considerations in the Shower. For many seniors, the bathroom is one of the most dangerous places in the home. Wet, slippery surfaces, poor balance, and reduced mobility can make even a simple shower a risky activity. According to the Centers for Disease Control and Prevention, CDC, falls are the leading cause of injury among older adults, and a significant number of these accidents happen in the bathroom. That's why, beyond adjusting shower frequency, it's critical to focus on making the showering process as safe as possible. One of the simplest yet most effective ways to enhance shower safety is by installing grab bars. Many seniors rely on towel racks or shower doors for support, but these structures are not designed to hold weight and can easily break. Properly installed grab bars provide sturdy support, making it easier to step into and out of the shower without the risk of slipping. Experts recommend placing at least 2 grab bars, one near the entrance of the shower and another inside for stability while washing. Equally important is using non-slip mats or shower strips to reduce the risk of falls. Traditional bathroom floors and tubs become extremely slippery when wet, creating a dangerous environment. Placing a rubberized non-slip mat inside the shower and another one just outside can prevent slipping when stepping in and out. Seniors should also consider using a shower chair or bench, which allows them to sit while bathing, reducing fatigue and eliminating the need to stand for long periods. Water temperature is another factor that requires careful attention. Seniors have thinner, more sensitive skin, making them more prone to burns from hot water. A thermostatic shower valve or an anti-scald device can be installed to regulate temperature and prevent sudden spikes in heat. The ideal water temperature for seniors is between 98 DGEF and 105 DGEF. Warm enough for comfort, but not too hot to cause skin irritation or burn. Seniors who experience dizziness or lightheadedness from temperature changes should also be cautious about standing under hot water for extended periods, as this can lead to a drop in blood pressure and increase the risk of falls. Another important consideration is bathing time and supervision. While many seniors prefer privacy, those with mobility challenges, cognitive decline, or a history of falls may need assistance from a caregiver or family member. Even if full assistance isn't required, a caregiver can stand by outside the bathroom door to ensure the senior gets in and out safely. For seniors living alone, using a waterproof medical alert button or a smart shower monitor can provide an extra layer of security. These devices allow seniors to call for help in case of an emergency, ensuring that assistance is available when needed. Proper shower products also play a key role in safety and skin protection. Mild, fragrance-free soaps and shampoos are recommended to prevent irritation, and soap dispensers or mounted pumps can reduce the need to fumble with slippery bottles. Seniors with arthritis or limited dexterity may also find it helpful to use long-handled sponges or washcloths to reach difficult areas without straining. Additionally, soft, absorbent towels placed within easy reach can prevent the need for unnecessary bending, reducing the risk of losing balance. For those who struggle with fatigue or weakness, showering at the right time of day can make a significant difference. Mornings are often best, as seniors are more alert and energized, whereas showering in the evening may be more tiring and increase the risk of dizziness. However, personal preference plays a role, and seniors should find a schedule that feels most comfortable and works with their energy levels. Lastly, dressing for safety after a shower is just as important as the shower itself. Seniors should use absorbent robes instead of small towels to dry off without rushing. Slip-resistant slippers or comfortable non-skid footwear should be worn immediately to prevent slipping on wet floors. Ensuring the bathroom is well lit and free of clutter further reduces hazards, making it easier to move around safely. By implementing these safety measures, seniors can continue to enjoy their showers without unnecessary risk. A well thought out showering routine combined with the right safety tools makes a world of difference in maintaining independence while staying protected.